At the Virginia Breast Cancer Foundation's annual luncheon in October, the nonprofit announced the expansion of its diagnostic and screening fund for Richmond and Petersburg.
Helps for better outcomes and helps save lives.
Kirsten Millar with VBCF says the fund will help bring women back for their follow-ups.
Some people just delay, or they say, I can't do that right now, I'm going to have to wait a little bit, or they just don't come back at all. And as we know, early detection with breast cancer is the most important thing.
Annual mammogram screenings are usually covered by insurance, but if doctors need patients to come back for more tests like an ultrasound, diagnostic screening, or an MRI, patients often have to pay out of pocket.
You can qualify to get those services.
The fund is aimed at uninsured or underinsured people who earn up to 400% of the federal poverty level,
which is about $60,000 for an individual and $124,000 for a family of 4.
In 2022, the VBCF Diagnostic Fund started in Southwest Virginia, an area with one of the highest diagnoses of breast cancer. With the fund, 1,700 services were provided for more than 700 women. 13 of them were diagnosed with breast cancer.
They were able to move on to their treatment very quickly.
There's this gap between screening and diagnosis.
Dr. Preeti Shah, head of breast imaging at VCU Health, sees firsthand the number of patients who may not come back.
There are national studies that show up to 21% of women will skip additional breast imaging if they have an out-of-pocket cost. And these numbers are not just statistics, they're not just data points, they're representing the lived experiences of everyday people.
Dr. Shaw serves on the board of the VBCF. The local nonprofit has partnered with VCU Health to provide the extra services, and money from donors help fund it.
Those tests can range from a couple of $100s to a couple of $1,000.
The Virginia Breast Cancer Foundation is a statewide organization that started in 1991 when 5 women met at a breast cancer support group at MCV. The group's mission is research, advocacy, and education. They often lobby on the state and national level. In the works now, pushing for a bill in the General Assembly to eliminate out-of-pocket costs for follow-up diagnostic services. Millar and Dr. Shaw say the expanded fund for Richmond and Petersburg is the right step forward.
The cancer's always there. It's not going anywhere. So if we can diagnose it early, we have the best opportunity for survival.
Dr. Shaw has already referred a patient to the fund. If you need help paying for additional services, if you get a call back after your mammogram screening, call this number first to see if you qualify. It's 804-237-6622. For Buddy Check 6, I'm Reba Hollingsworth.